This is a brief introduction to our lecture on schizophrenia. It is one of the major diseases that we will cover in this course, and it's important to thoroughly understand both the disease and nursing interventions. As you can see from this slide, both the cerebrum and the cerebellum are affected in this disease. All of the areas that are colored are impacted. What does this mean for your nursing interventions with these clients? It will require a multi-intervention, interdisciplinary approach to care. As we go over the content in this video, I want you to consider for a moment what it's like to live with a chronic illness that has a heavy stigmatization. From a developmental level, if you're in your teens, what are the challenges that you face according to Erikson's developmental stages? How might this impact your future growth and development? A bit about schizophrenia. It's a chronic disease. What does that mean? The symptoms are managed, but the disease never goes away. It's marked by a slow onset. This can make it more difficult to diagnose. The disease is marked by episodic changes, which means that interspersed between periods of wellness, there are psychotic thoughts, hallucinations, and disorganized behavior. Remember, the onset is slow. It is very easy for these clients to be simply characterized as odd or quirky, thereby delaying the diagnosis and treatment. It's important to complete a thorough assessment, and this begins with getting a good history. Because this disease process waxes and wanes, it's important to find out where the client is at the moment so that baseline measures can be established. A bit of demographics on this illness gives us some perspective on how it impacts public health. Schizophrenia is the 7th leading cause of disability. It affects women and men equally. The typical onset occurs in the late teens or early 20s. It is usually an acute psychotic episode which causes the client to seek treatment. This disease affects more than 2 million Americans each year. Only the most ill of individuals are cared for in an acute setting. That means that those affected are in our communities. We see them in grocery stores, at church, and at school. Unfortunately, for those who do not seek treatment, these individuals are also found on the streets due to homelessness and in jails due to crimes that are committed. This shows you the terms that are used to differentiate between different types of schizophrenia and the behaviors associated with the disease. If you're not familiar with these terms, they can be found in your text. Stereotyping and stigmatization are predominant in this disease. It's very important that you get in touch with your personal belief system before caring for these clients. Remember that we're caring for an individual with a disease process, not a disease. Although schizophrenia will cause life-altering changes, it does not mark the end of health and wellness. Recovery and remission are possible. It is part of our role as healthcare professionals to avoid stereotyping that can lead to shame for the client and ultimately to poor health outcomes. The symptoms of schizophrenia are characterized by positive and negative. This does not mean positive as in good symptoms and bad symptoms. Rather, think of them as symptoms which cause a heightening of emotion, sensation, and thoughts, and those that cause a decrease. The positive symptoms of schizophrenia are hallucinations, which can be auditory or visual. They can occur at any time. Delusions are personal beliefs that are not based in reality. Disorganized thoughts come in all different forms and can range from magical thinking to impairments in judgment and insight, and this leads to bizarre behavior. When we talk about negative symptoms, we should think a lack of something. Remember going back to our medical terminology where A indicates without. So alogia is a poverty or lack of speech. Affective flattening is marked by little or no demonstration of emotion. Asociality is not wanting to maintain any type of relationship, even with family or friends. Evolution is little drive or motivation to attend to activities, and this can include activities of daily living. Lastly, anhedonia is an inability to experience pleasure. Cognitive ability comes with higher level processing of the brain. Clients can demonstrate bizarre patterns of speech, use of words, strange behaviors, and an inability to understand communication that's directed at them. We will discuss this in depth in our lecture, but nursing interventions should help clients, especially during periods of acute psychoses. Remember, client safety is always first. This model demonstrates how at any given point in time the client can be experiencing positive, negative, and cognitive symptoms. This can make care of these clients a challenge. Although I stated it already, it is really important to remember that each client will have unique symptoms, as their perception is their reality. By avoiding stereotyping, we do not place artificial barriers for the client as they work towards maximization of their health. Lastly, assessment is both determining the client's current status and used to develop a baseline for future functioning. Goals for the client should be individualized based on their individual needs. Be sure to include the client's environment in this process. Look at the home setting, support systems, and potential causes of stress. The family is an integral part of this process and can provide a wealth of information. The goal, remember, is wellness and maximization of health. It can be challenging as many of the interventions for this disease has negative consequences, such as medications causing weight gain, leading to the potential of other health issues like metabolic syndrome or diabetes. When considering wellness, all aspects of the client should be thought of. It's important in goal setting to reach towards realistic goals that the client would like to achieve, not what we think is in their best interest. Medication management is a large component of treatment for clients with schizophrenia. Side effects can make this and compliance a challenge. The top priority is always achieving the greatest movement towards health promotion and maintenance. This is best accomplished by focusing on wellness, not the disease. It is readily apparent in clients that have been hospitalized a number of times that it's difficult to maintain hope towards wellness versus an orientation towards being a patient when you have no power over your health. You can click on this link to watch this YouTube video. It will provide you some insight into the world of auditory hallucinations. As you watch it, consider how difficult it would be to have this type of a distraction 24 hours a day. So how do we focus on wellness? We do it by honest communication with the client and the family, completing a thorough assessment to determine the client's current status and their understanding of their health state, and focusing on identifying strengths that can be used to move forward towards a new definition of health. Education should focus on the disease process, medication management, and recovery. In this process, we should also discuss the potential for relapse and how and when to seek healthcare support. The education that we provide our clients will allow them to have power over their health and ultimately lead to better health outcomes.